So good afternoon, students. So I am Dr. Mercy, Assistant Professor in the Department of Community Medicine, Sri Lakshmi Narayana Institute of Medical Sciences, Pondicherry. So today's theory class will be on blindness. Okay. So the outline of my presentation will include the definition for blindness, categories of blindness, causes of blindness, the WHO and NPCB comparisons, problem statement, the prevention and the interventions with respect to the school health program, Vision 2020, eye donation, and the national program for the control of blindness and visual impairment. This will be the outline of today's presentation. So the main university questions in this topic will be on the blindness and enumeration of the causes of blindness with a note on its prevention. What are the school health programs on blindness, and write about the vitamin A prophylaxis and the national program for the control of blindness and its goals and strategies. The District Blindness Control Society and the Vision 2020. Okay. So the definition will be, the WHO definition on blindness is the visual acuity of less than 3/60, that is the Snellen's or its equivalent, in the absence appropriate vision charts by non-specialized personnel. Next will be the inability to count fingers in daylight at a distance of 3 meters to indicate less than 3/60 or its equivalent. So this is the WHO definition for blindness. So what are all the categories of visual impairment that leads on to blindness? Is that the maximum less than 6/12, then minimum equal to or better than 6/60, and low vision less than maximum 6/60 and minimum of less than 3/60, and finger counting that 1/60, and light perception, there will be no light perception. Okay. Next, the types of blindness. So there are many types of blindness. They are listed below. These are the economic blindness, social blindness, manifest blindness, absolute blindness, curable blindness, preventable blindness, and avoidable blindness. Moving on, there's certain definitions also you must know. So what do you mean by visual acuity? It's the sharpness of vision measured as maximum distance the person can see a certain object divided by the maximum distance at which a person with normal sight can see the same object. So economic blindness is nothing but it's the inability of a person to count fingers from a distance of 6 meters or 20 feet. Okay. So social blindness is vision 3/60 or diminution of field of vision to 10 degrees. Next, manifest blindness is vision 1/60 to just perception of light. Next, absolute blindness is there will be no perception of light. Okay. Next, curable blindness, which means that stage of blindness where the damage is reversible by prompt management. Example, the cataract. Preventable blindness is loss of vision that could have been completely prevented by institution of effective preventive or prophylactic measures. Example, xerophthalmia and trachoma. Next, the avoidable blindness. The sum total of preventable or curable blindness is often referred to as the avoidable blindness. Moving on, what is the comparison of WHO and the National Program for Control of Blindness definitions? Okay, so in low vision, it is as per the category 1, the visual acuity should be less than 6/18 to 6/60, which is denoted as low vision, whereas category 2 is less than 6/60 to 3/60, which is the economic blindness. Next, in blindness, there are of 3 categories, that is the social blindness, manifest blindness, and absolute blindness. So it is less than 3/60 to 1/60 is social blindness. Less than 1/60 is the perception of light is manifest, and if there is no perception of light, it is the absolute blindness. So what is the problem statement? So in the world, around 180 million people are visually disabled, of them 45 million are blind, and 80% of the blindness is avoidable. Major cause of blindness and their estimated prevalence are as follows. So the cataract accounts to about 19 million, and glaucoma 6.4 million, and glaucoma around 6 million. So childhood blindness around greater than 2 million. Okay. So other 10 million is 32% of the world are blind between the age 45 to 59 years. Okay. So in India, the annual incidence of 2 million cataract or induced blindness is seen. So the National Survey on Blindness 2001 and 2 shows the prevalence of blindness as follows. So greater than 50 years, it is 8.5%, and in general population, it is around 1.1%. And in age, children 10 to 14 years, it is around 6 to 7%. Okay. So the prevalence of blindness will be greater than 50 years, it was 8.5%, and in childhood blindness, it is 0.8 per thousand. Okay, in children to 5 to 15 years of age, the visual impairment is 6.4%. So what are all the causes of blindness in India? So the major causes, as you already know, is the cataract and uncorrected refractive errors, mainly in children and the elderly, and glaucoma and corneal opacity. Whereas a childhood blindness or uncorrected refractive errors, vitamin A deficiency, developmental cataract, retinal conditions, optic atrophy, and certain congenital anomalies. So what are all the causes of blindness in the developed countries? So mostly it is of the non-nutritional causes like accidents and glaucoma, and certain non-communicable diseases like diabetes or due to the degeneration of ocular tissue. Whereas the leading causes of childhood blindness will be the congenital cataract or glaucoma and optic atrophy. So most of them are of non-nutritional causes. Okay. So the epidemiological determinants you must know. So age, mainly in children and young, it is the refractive errors. In adults, it is the cataract and all the chronic conditions. Whereas in sex, it's of high prevalence in women, leading to higher prevalence of blindness in women. Okay. So malnutrition, mainly the childhood illness like measles and diarrhea, and protein energy malnutrition also leads on to blindness. Occupation is those working in factories or working in the exposure to dust, industrial prone, and eye injuries are more common in those working under industrial conditions. Okay. So social class is mainly, it is blindness is more common among the low socioeconomic groups. That is, they have poverty, low standards of living, and lack of hygiene and inadequate health services. So these are some of the epidemiological determinants of blindness. So how can you prevent the blindness? There is a national program in which there are many components of actions like the initial assessment or survey, and methods of interventions like the primary eye care, secondary eye care, tertiary eye care, and certain specific programs are there, and long-term measures, and finally the evaluation strategies. Okay. So what are all the strategies in the initial assessment? So first we have to assess the magnitude or the problem statement or the burden of the particular health condition. Next, we have to see for its geographical distribution, and finally we have to come down with the causes of blindness with its prevalence survey. Okay. So the modes of interventions, like in primary eye care, what you can do, it's mainly treating the eye conditions at the grassroots level. That is the primary prevention, mainly by personal hygiene, sanitation, and good dietary habits, and also safety measures we have to follow. So the final objective is mainly to increase the coverage of health facilities and the quality of eye care settings, mainly through the primary healthcare approach. So secondary is early diagnosis and treatment by means of mobile eye clinics. So the main advantage is that using of the localized resources in order to early diagnose the condition and provide an inexpensive eye care to the population at the peripheral level. Okay. So tertiary care is mainly the tertiary care centers wherein the institutes and medical colleges comes into play, wherein we do the retinal detachment surgeries, corneal grafting and etc. And other measures of rehabilitations also we carry out in these special schools. So that comes under the tertiary care sector. So coming to the programs with respect to blindness is the National Trachoma Control Program, and there are school health eye services and health education, vitamin A prophylaxis, and finally occupational eye health services. Okay. So in vitamin A prophylaxis, we give 9 mega doses are to be given from the age of 9 months up to 5 years of age. So in the 9th month, we give us a 1 lakh international units. And from the first year, after the first year, that is from 16 to 18 months, every 6 months, we give us 2 lakh international units up to the age of 5 years. Okay. So long-term measures is mainly aimed at improving the quality of life and by improving the factors responsible for persistent eye health problems. So that maintaining the sanitation and hygiene, adequate water supply and personal hygiene. So this is the national program, which is the Control for Blindness and Visual Impairment, was launched in 1976. It's a 100% centrally sponsored program, and it incorporates the earlier trachoma control into this program. So as I said, it's a 100% centrally sponsored. Okay. So how to decentralize this program? We have District Blindness Control Society in each and every district. So the main goal is to reduce the prevalence of blindness from 1.49% to less than 1%. So that is, it's less than 0.3%, and to establish an infrastructure for efficient catering of the new cases and to prevent the future backlog. Okay, and also to enhance community awareness, to expand the research, and finally to participation of the NGOs and voluntary organizations. So the main objective is to reduce the backlog of avoidable blindness and eye health for all. And finally, the Regional Institute of Ophthalmology and additional human resources and infrastructure facilities. Okay. And what are all the strategies we follow? So the main strategies we follow is emphasis on free cataract surgeries, diabetic retinopathy, glaucoma, corneal transplantation, vitreoretinal surgeries, and childhood blindness. And screening of school children for identification of and treatment of refractive errors. Okay. Coverage of underserved areas for eye care through public-private partnership, capacity building for health promotion and health personnel, IEC activities for the community, strengthening of the Regional Institute of Ophthalmology and medical colleges of the state and district hospitals. So continuing emphasis on primary eye care, that is a multi-purpose district mobile ophthalmic units for better coverage, participation of community and Panchayat Raj institutions, and involvement of public-private partnership. Okay. So organizational structure is central. We have the DCHS and MOHFW, and that is the Ministry of Health and Family Welfare. At the state level, it is the State Ophthalmic Cell and the Director of Health Services, and district is the District Blindness Control Societies. So at the tertiary level, it is the medical colleges, secondary level is the district hospital, and primary level it's the sub-district hospital. Okay. So this is about the District Blindness Control Society, mainly to achieve the maximum reduction in avoidable blindness. Program emphasizes on comprehensive eye care, school eye screening, and community-based rehabilitation. So these are some of the activities under the National Program for the Control of Blindness. Okay. So these are some of the IEC activities, that is information, education, and communication activities through this program. So school eye screening program is mainly followed at the age group of 10 to 14 years. School teachers are trained for screening the children. So this is how they do a school eye screening program. And collection and utilization of donated eye is carried out by eye donation strategies. There are almost 40,000 donated eyes every year, and these are done by the hospital corneal retrieval program. Okay, and we celebrate this eye donation fortnight at 25th August to 8th September. And some of the newer initiatives under this program is provision of free classes and eye testing fortnightly and provision of mobile eye clinics, and to promote the eye donation strategies by hospital cornea retrieval program. So these are some of the newer initiatives. And externally funded agencies that aids these programs are WHO, DANIDA and World Bank. Okay. So note on Vision 2020, which is the right to sight, in order to initiate the reduce initiative to reduce the avoidable blindness by the year 2020. Main features are target diseases, human resource development, and infrastructure and technological development. So this is the right to sight or the Vision 2020 target diseases. So this is a plan of action for India, which is a proposed structure. We have at the primary level vision centers, service centers, training centers, and finally the center of excellence. So services at each center is mainly the primary level is a screening strategy. Secondary level is early diagnosis and treatment by cataract surgery and other facilities for refraction. Tertiary level is mainly the training centers for tertiary eye care services of retinal surgeries and glaucomas and conducting CMEs, and centers of excellence mainly to set standards and quality assurance, and finally research and development. Okay. So the summary of our today's presentation or today's class will be how is the problem statement, what is the strategy for prevalence, and what are all the activities carried out under the National Health Program for Blindness, and what is meant by the Vision 2020 or right to sight. Okay. So these are the references which I referred for this topic. Okay. Thank you all.